welcome to our video on exercises and interventions.
Every action we do in a given day, from brushing our teeth to walking the dog, comes down to the organization and action of multiple skeletal muscles. We bend, we stretch, we push our bodies to the limit, and although they may get tired, our muscles rarely fail us. These muscles, our bones, and joints work in tandem to allow us to interact with the world, and we use glucose to convert chemical energy into a molecule called ATP during cellular respiration to allow this.
Our patient Hazel is 6 years old and has a condition called spastic cerebral palsy. This causes her to have a low walking endurance. She also has epilepsy and attention deficit hyperactivity disorder, also known as ADHD. Cerebral palsy is caused by damage to the motor cortex area of the brain, usually before, during, or shortly after birth. Her condition affects muscles on her anterior mid-torso and posterior lower torso. This causes her to have difficulty walking properly.
The right psoas minor is a muscle that has an origin located at the T12 and the L2 vertebrae, and an insertion located at the iliopectineal eminence and the pectineal line of the pubis. This muscle is a flexor, and it flexes and laterally bends the lumbar vertebrae. Some examples of activities that use this muscle include walking upstairs, running, and lifting.
The name of the muscle is the right quadratus lumborum. Its origin is the posterior part of the iliac crest. Its insertion is transverse process of the lumbar vertebrae 1 through 4 and the 12th rib. Its action is laterally bends the trunk, and it is a extender, and daily activities to do with it is reach down to pick stuff up, sitting and standing and walking.
The right tensor fasciae latae is located on the proximal anterolateral thigh. Its origins are the anterior part of the iliac crest and the anterior superior iliac spine. The insertion of the right tensor fasciae latae is between the two layers of the iliotibial tract of the fascia lata. Its primary actions are to flex, abduct, and medially rotate the thigh while also providing joint stability in the hips and knees. Daily uses of the muscle include running, walking, climbing stairs, sitting, and standing.
The left gluteus medius is located on the posterior side of the body. The origin is located on the external surface of the ilium, the upper part of the pelvis, between posterior and anterior gluteal lines. The insertion is the greater trochanter, or upper outside edge of the femur. The left gluteus medius abducts or moves the muscles away from the femur. This muscle is both a flexor and an extensor, and it is used for stability in walking and running and standing on one leg.
According to Cleveland Clinic, a few exercises and stretches that can help the muscles we talked about are half kneels, leg lifts, and marching. Thank you for watching our video.